Hi, today we're going to talk about the cardiovascular system, particularly the blood vessels and blood circulation. We know that blood vessels could either be arteries or they could actually be veins. Arteries carry oxygenated blood, while the veins carry what? Deoxygenated blood. In most textbooks, arteries are represented with the red color, while the veins are represented by the blue color. Now, what is the name of the blood vessel that is considered the smallest blood vessel that connects the arteries and the veins? That is actually called the capillaries. Now, what do you call a small vein? Venule, V-E-N-U-L-E. What do you call a small artery? An arteriole. Okay. In the previous lectures on the heart, we know the heart pumps blood into the aorta, and the aorta gives rise to the small arteries. Okay. So, in the blood vessels, we have discussed the lung and the heart before. And we know that when it comes to blood, bringing blood to the heart and bringing blood to the lungs and bringing blood away from the heart and bringing blood away from the lungs, it's important to know the names of these blood vessels that causes the formation of the pulmonary and the systemic circuit. And blood vessels have three distinct walls: tunica, adventitia, media, and intima. The adventitia is made of elastic connective tissue. Media is where you have the smooth muscles that can either contract and relax, causing either vasoconstriction when they contract, and when the smooth muscles in the wall relax, you have vasodilation, which will increase the blood flow. And the intima is the one that is lined with the endothelium, which is very, very smooth when you're young, and the blood vessels can be thick. Okay. So again, intima, you have the endothelium. Your media, the smooth muscle layer, which can either lead to vasodilation when the smooth muscles relax, and lead to vasoconstriction or vasospasm when the smooth muscles contract. And the adventitia is where you have the elastic fibers or connective tissue fibers. So this is what is shown in the layers: the adventitia, the media, and the intima. And again, these are just a comparison between arteries and veins, and they are run in parallel together with the lymphatic vessels. If you remember on the lecture on the lymphatic vessels, walls of arteries are thicker than veins, and arteries have more. Take note, more arteries in their tunica media, but the vessel lumen in the veins are much, much larger than compared to the arteries. Okay? So again, this is just to give rise to the features, so make sure you're aware of these. The presence of vessel lining and their different unique features. But one distinct feature of veins are the presence of valves, which has two main functions. Number one, to prevent backflow, and number two, to allow the blood to flow in one direction. Okay? Arteries do not have valves, by the way. So see how the comparison between an artery and a vein is: the walls of the artery are much thicker, while the veins are thinner, but the lumen is much, much larger in the veins. Okay? And the smooth muscle would be found in the tunica media, as I said, endothelium in the tunica intima. Now, some books refer to this as the tunica interna. Okay? So again, just take a look at this slide. When you go over the slides, when you read on your own, the comparison between veins and arteries, and what would connect them would be the capillaries. It is here where the exchange of gases and nutrients will occur. And as you can see, what you call a small vein, venule, what you call a small artery, arteriole. And the bottom portion of the slide shows you the different types of capillaries, which can either be fenestrated, which means on the wall of the capillaries you have holes or pores, which will facilitate the exchange of nutrients and gases. At the same time, continuous means there are no pores or holes. So there are different types of arteries, could either be elastic, muscular, and the small arteries are called arterioles. So here's just the features that is seen, like the aorta is the largest artery that you can find. As you recall, it comes from the left ventricle. You have the ascending aorta, arch, descending aorta, thoracic, abdominal aorta. You can also have your brachiocephalic trunks, which is found in the right side, and the pulmonary trunks. So again, the features are very important, that make sure you study them. The different components of the tunica intima, which includes the endothelium, the media, which includes smooth muscle, and of course your adventitia, which is made up of elastic connective tissue fibers. Again, arteries, I want you to know that there are certain arteries that you cannot afford to miss. Like if it's in the radial bone, radial arteries. Ulnar bone, ulnar arteries. At the back of the knee, popliteal. In the femoral triangle, inguinal area, femoral arteries. Here, what you call the arteries here, it's in the brachial artery, okay? Brachial means arm. in here, okay? Now, at the same time, you have these other arteries there. You normally get your blood pressure, by the way, from the brachial arteries. So you have muscular arteries, such as radial and ulnar. And arterioles, as I said, are the smallest arteries, 30 microns in diameter. And of course, you have this slide showing you the arteriole. And the capillary, smallest of all the blood vessels, only 8 microns in lumen diameter. And that is exactly more or less the size of a red blood cell it can go through. Because it's a red blood cell that transports oxygen and carbon dioxide. And again, could either have these types, continuous, fenestrated, and you have the sinusoids, which are called discontinuous capillaries. So be aware of the difference between these types of capillaries and their significance and roles, okay, that they play. So diffusion occurs in the endothelial cells, or what we call gap within these endothelial cells, or through pores or gaps. And again, there could be connecting arterioles with venous with anastomosis, and there could be channels. So this is a very nice slide which I want you to study. You can see the red part, which is the artery, and the blue part is the vein. What we call the small vein, venial, what we call small artery, arterial. And this is where you find the capillaries, and you find the cells everywhere, okay? So whatever you find in the capillaries, they can diffuse to the cell, and whatever waste like carbon dioxide comes from the cell goes into the capillaries and be brought here into the venous blood, okay? So you can find everywhere. You have brain, heart, all these are filled with all areas of the body sort of a capillary, because it has to be able to allow exchange of gases to take place, okay? So we have all these. So again, I do not want to read the slides with you. For you, you can just see that, make sure you study this particular slides because they are important, okay? Now the veins, what we call the smallest veins, you have venials, and you have different types of veins depending on the size. The largest vein would obviously be the vena cava. You have two superior and inferior vena cava. The superior vena cava drains all the veins from the head, the neck, and the upper limbs. The inferior vena cava, which is found below the heart, drains all the veins in the foot or the feet, the leg, the thigh, and any organ below the heart. So veins, what we call the small veins, venials. See? And of course you have the medium-sized veins, like radial, tibial, popliteal vein. So this is the slide for those medium-sized veins. And as we have emphasized, they have valves, which prevents backflow and allows the blood flow in one direction. Okay? So if these valves are not working, you end up with what we call varicose veins, because now the blood cannot go up, they remain here, and these valves become engorged, or these veins become engorged, filled with and distended with blood. So large veins, as we know, you have the superior and inferior vena cava, right? So these are superior and inferior vena cava. And again, veins in the lower extremities to us to ascend to the heart. So these are ways upon which we can bring the blood from the feet and the leg through the heart via what we call a muscular pump. So propel blood back to the heart, and the valves allow prevention of backflow. And even changes in the thoracic pressure can allow movement of the blood. So here is just to show you that arteries and capillaries contain 30 to 35% of the volume of what blood we have. Most of the blood are found in the veins, 65 to 70%. And again, you can see here the different roles played by the veins as what we call blood reservoirs. Okay? So here is just a distribution of blood in the cardiovascular system. I don't expect you to memorize this. It just proves one thing: most of the blood are found in the veins. Okay? So pulmonary circuit refers to the movement of blood to the lung from the heart, and from the lung back to the heart via the left atrium to the pulmonary veins. Systemic circuit refers to all the blood coming from the aorta and all the blood going into the vena cava that goes into the right atrium. Okay? So again, differences between these two circuits. It's very important to differentiate one from the other. And the exact name of these blood vessels. Sometimes it gets confusing. Which one is pulmonary artery, which one is pulmonary vein? Okay? So distribution of artery and veins is the same as the left side as on the right side. And again, as we said, when the blood leaves the right ventricle, it passes to the right pulmonary and left pulmonary arteries. We came from the pulmonary trunk. They go to the lungs, and once exchange of gases take place, we get rid of the carbon dioxide. We bring in oxygen when we inhale. How does the blood go back to the heart? Via the pulmonary vein. There are 4 of these. Arteries, there are only 2, one on the left, one on the right. For the veins, there are 4 pulmonary veins. That means you have 2 pulmonary veins coming from the left lung and 2 pulmonary veins coming from the right lung. So be aware of that. See? So this is a pulmonary circuit, because it involves the lung, and the systemic circuit involving the systemic organs. So be aware of this very important slide. So as you can see here, it involves both the heart and the lungs. Exchange of gases occurs within the pulmonary capillaries and the air sac, or what we call alveolus of the lung. And the aorta, we talked about this, the ascending, the arch, and descending aorta. And making sure that you know some of the names of these blood vessels. Now I don't expect you to name all the blood vessels, but at least the big ones. Like here you have the aorta, ascending, arch, and descending. You have a brachiocephalic tract, there is none on the left. From the aortic arch, you have the left subclavian and left common carotid, while in the right side, the right common carotid and the right subclavian artery will come from the brachiocephalic trunk. Now it is the common carotid that brings blood to the brain, so bear in mind. On the other hand, the subclavian becomes the axillary becomes the brachial divided into radial and ulnar arteries. Subclavian because it means it's below the clavicle. Okay? So the aorta is the biggest artery, be aware of that. It has an aortic valve in the left ventricular chamber. And these are some of the branches, so be aware of the differences. As I have said, there is no brachiocephalic trunk on the left, so be aware of that. So this is an angiogram. What's an angiogram? We inject a dye into the blood vessels and we take an x-ray or a CT scan. You can see the presence of the blood flowing through these different blood vessels. So again, some arteries you have to know, like the carotid arteries for the carotid pulse in the neck. This is the brachial artery where you actually get the blood pressure, and it's called the brachial pulse. What about the radial pulse? Would be in the radial artery, very important. And make sure you are aware of these. Now the other details you don't maybe not have to know, but again the big ones as I already mentioned should be learned by you. Okay, common carotid. Now divide into two, external and internal carotid arteries. Under the name, brachial, radial, ulnar, and arteries of the hand, palmar arches. So this is a cadaver specimen showing you the different arteries around the brachial plexus. And of course the carotid divided into the internal and external carotid. So carotid sinus is found at the base of the internal carotid artery, and apparently it has baroreceptors that is able to detect changes in the blood pressure. And chemoreceptor changes in your different levels of carbon dioxide, O2. Okay? So this is the carotid sinus, internal carotid. Now also the other branches which you don't have to know, and these are some detailed branches already. Okay? Lingual obviously goes to the tongue, facial to the face, and then branches to the brain. They're called cerebral arteries. When you're dealing with stroke patients with a cerebrovascular accident, when you suffer from a stroke, these are the arteries that usually are involved. Cerebral means brain arteries. Okay? There you are, cerebral arteries. And the aorta with all the other branches that gives rise to the circle of Willis. Now, because of the overwhelming amount of information, you don't really have to know all the names. Just as I said, the big major ones you need to know. Because if the doctor tells us, hey, check for the carotid pulse in the neck, check for the brachial pulse here, near the elbow, okay? Radial pulse. When I say femoral pulse, inguinal area, what about popliteal, behind what? The knee. What about dorsalis pedis pulse, or pedal pulses on top of the foot, okay? So aorta, just know that here it's called thoracic aorta, and then once it pierces the diaphragm, it's called abdominal aorta, divided to the right and left common iliac. Now take note, every organ has its own artery. If it goes to the kidney, real artery came from the aorta. It's like a freeway. It's 5 north, 5 south, and these are the side streets. In this case, it's called the real artery that brings oxygenated blood to the kidneys. You have 2 kidneys, one on the left and one on the right. So these are just some of the branches from the aorta. And you don't have to memorize, there's so many of them, see? Renal, even branches to your digestive tract organs. There's so many of them. Spleen, sphenic artery, gastric artery, common hepatic artery, okay? And of course, to the small intestines, superior mesenteric artery and pancreas, and different branches. Inferior mesenteric artery, the same thing. And of course, the other branches coming from the aorta, which go to these organs, as listed there. And then phrenic, usually phrenic means what? The diaphragm, okay? Adrenal gland, you have adrenal arteries, or suprarenal, because that's the other name of adrenal. Renal arteries for the kidney, and then of course the ovaries and the testicular arteries, ovarian arteries, okay? Again, you have the internal and external iliac, which came from the common iliac. The common iliac divides external and internal iliac, then becomes femoral artery, a continuation of the external iliac, and then the femoral becomes have different branches, which becomes the popliteal at the back of the knee. And what you call the artery on top of the foot, dorsalis pedis pulsa. If you are told to palpate for it, you should be able to do that on your own feet or foot. At the back of the knee, it's called popliteal. So there are a lot of arteries, at the same time lots of veins. So be aware of the bigger veins. Don't have to know everything, okay? So the veins, the bigger veins would be the superior and inferior vena cava. Take note that the superior vena cava is brought about by the right and left brachiocephalic vein. And the right and left brachiocephalic vein came from the subclavian vein and of course the jugular vein or the internal jugular veins. Okay? So again, the comparison between the different arterial venous systems, take note of this particular slide. Okay? So there are some of the veins. So notice some may have the same name, but some of them do not. For example, in the neck, we do not call it carotid veins, but we call it jugular veins, both external and internal. You have the brachiocephalic vein, which is brought about by the subclavian and the internal jugular veins. So you have your basilic, cephalic, axillary vein, just like axillary artery, axillary vein, radial vein, ulnar vein. Femoral artery, then you have a femoral vein. Then you also have a popliteal vein. So more or less similar to the arteries, right? So what did we say about the superior vena cava? They are the ones responsible for draining all the blood from the head and the neck and the upper limbs, and which includes the veins going to the brain and from the brain, right? Cerebral veins, all these sinuses are also important. See? So all the veins in the head, the neck, they go into the superior vena cava. So there are just some of the other veins, cavernous sinus. I do not expect you to memorize this, but just be aware that the veins from the head, the neck, and the upper limbs go to the superior vena cava. And these are all other names. So some of the names are based on where they are located. Like in the face, they're called facial veins. In the maxillary area, where the bone where the upper teeth is attached to, it's called the maxillary veins. The maxillary vein is the maxillary facial vein to the face. And of course, the veins of the upper limb. See, here we have the cephalic vein. This is the axillary vein. You have the radial and ulnar veins. So be aware that when you work as a nurse, this is where you insert most likely your IV fluids, or this is where you get the blood, right? When the phlebotomists get your blood, they normally do it here in the area where you have the veins near the elbow, okay? So you have cubital veins. So cubital refers to the area where you have the elbow, okay? And again, the different veins, as we said, are named. Now, as you move forward, you can see the veins of the hand, the palmar vein, right? There you are, the palmar arch veins. Azygous veins and hemiazygous veins, these are like alternative routes for the veins, and they're found on the side of the vena cava, azygous and hemiazygous veins. Inferior vena cava, as we said, veins all the veins from the feet, the leg and the thigh, and any organ below what? The heart, right? So apparently all the veins, iliac, lumbar, gonadal veins, hepatic, abdominal veins. So anything behind the heart, they go into the inferior vena cava. All the veins here. See, so all the veins as we have listed here. Again, I do not expect you to know, but the big ones, the femoral, popliteal, iliac veins, be aware of them. See, there you are. Okay. So saphenous veins are leg veins. They are important because the saphenous veins are used as a graft for when we do bypass surgeries for coronary artery bypass graft, or when we do a bypass graft surgery for the heart, we get the graft from these leg veins. Now you might be wondering what happens. If you get the leg vein, it's okay because you have other leg veins that can take over the leg vein that's been removed. Okay? So again, these are just some of the name of the veins. So I don't expect you to memorize all of them, but just get to know the bigger ones. Okay? Now the hepatic portal system, if you have the time, please read on this. This is unique because this is the blood vessel that brings blood not away from the organ, but rather it brings blood to the liver. The hepatic vein is not the same thing as the hepatic portal vein. Okay? So hepatic portal vein actually is made up of these veins that will bring blood into the liver. Superior mesenteric, inferior mesenteric splenic veins, and even the gastric cystic veins. So they bring blood to the liver. While the hepatic vein, on the other hand, brings blood to the vena cava. Hepatic portal vein all the food we eat, all the nutrients will be stored in the liver and goes to the hepatic portal vein. See, these are all branches that contribute to the formation of the hepatic portal vein. You can hear the splenic vein, you can hear the inferior mesenteric that goes to the splenic vein, and of course you have the superior mesenteric vein. So superior mesenteric and splenic becomes the hepatic portal vein. So 70% of the blood that goes to the liver actually comes from the hepatic portal vein. The remaining 30% of the blood that goes to the liver will actually come from the hepatic artery. But all the blood will be brought out into the hepatic vein, into the vena cava, and to the right atrium to be brought to the lung for what? Release of carbon dioxide produced by the liver itself. Now, the cardiovascular changes at birth, you can just study this on your own. We will not cover this for this meantime, but if you are interested, you can just read on these. This has to do with the difference in the blood circulation of the fetus when the mother is pregnant. Okay? So we'll just end there.